Good morning. I'm Dr. Dale Bratzler. I'm the Chief Quality Officer here at OU Health, and I'm the university's Chief COVID Officer. I'm going to do my usual routine for the press briefing. I'm going to review the data through today that's come out from the State Health Department on COVID in Oklahoma. And then I'm going to talk about some of the issues that are of concern in Oklahoma and try to answer your questions. So a handout will be coming that has all of this information in it. April will send it to you after the briefing. Oklahoma, depending on which source of data you look at, is 7th in the nation in terms of new cases per day per 100,000 population. And if you look at the CDC's data, we are 6th in the nation with respect to the number of new cases per population within the past week. So we're certainly seeing a big surge of COVID cases in Oklahoma. And I included the U.S. map because it's really easy to see how hard hit Louisiana, Oklahoma, Arkansas, Missouri, Florida are right now with very, very high case counts of COVID-19. Sadly, today the State Health Department reported 2,342 new cases of COVID-19. That takes our 7-day rolling average up to 1,832 new cases a day on average. I put in a graphic in the handout that you'll see that shows where we're at now as compared to where we were last year. So on November 6th of 2020, there were 1,465 new cases per day. And then that next day, we had a big, big jump in the number of new cases per day. We were on February 11th at 1,762 new cases per day. And now in Oklahoma, we're at 1,832 new cases per day. What you see, if you look at the 7-day rolling average for the last month and a half, is almost exponential, sharp increase in the total number of cases. And what I'm quite concerned about is we're way ahead of the number of new cases per day than we were before school started last year. Most schools have not opened yet, so I do have real concern that we may see a real jump in the number of cases with the opening of school, and we're starting at a higher baseline. I think that's important to understand. Again, I've included information on the 7-day rolling average at 1,832 and have shown, remembering way back on June 7th when we were down to 99 cases a day in the state. Yesterday, the State Health Department updated both city, county, and zip code level data and showed that Craig County in Oklahoma has the most cases, 104 per 100,000 population per day. So clearly Northeast Oklahoma is still being most heavily hit. And in fact, if you look at the number of new cases a day, Tulsa had the most in the past week. Oklahoma County was second. And then very sadly, the number of hospitalizations is going up quite abruptly. Today, the State Health Department reported 954 Oklahomans in the hospital. 274 of those people are in the intensive care unit. That's a 29% ICU rate. Again, that number is growing very, very rapidly. And I think when I think about the Delta virus, the Delta variant of the COVID virus, I think the thing that concerns me the most is that with the sharp rise in cases, we can expect a sharp rise in hospitalizations. We saw that with the first peak of the disease last year, and we're seeing the same thing again. Whether we like it or not, a substantial proportion of the people who test positive do end up in the hospital. So hospitalizations may well continue to increase. And finally, my last point of update on just current status is I included the CDC's community transmission map, which shows that almost the entire state is in a substantial or high risk for community transmission, which means, based on the current CDC guidance, that if you're indoors in events, you should be wearing a mask. And again, I strongly encourage all parents to send their kids to school with a mask because that is the current recommendation both of the CDC and the American Academy of Pediatrics. So I wanted to talk just a minute about vaccination, not about the science, but about where we're at with respect to vaccines in Oklahoma. So yesterday's weekly epidemiologic report showed some good data. 48% of all Oklahomans have had at least one dose. 40% of Oklahomans are fully vaccinated. That's why we're seeing Delta spread so rapidly, because we have so many people in our state who are still vulnerable. If you look at the population of patients above the age of 65, 76% are fully vaccinated. Now, I highlight that because that means that 25% of the elderly, 65 and older, are not fully vaccinated. We know that people who have only received one dose of the COVID vaccine, particularly the RNA vaccines, are more susceptible to Delta variant than if they were fully vaccinated. So we pat ourselves on the back with how we've done with our older population, but we still have a lot of elderly Oklahomans who are at risk of COVID-19. I want to make that point. Secondly, I included data by age group, and again, depends on which data you look at, but only 23% of Oklahoman kids between the ages of 12 and 17 have received at least one dose of the COVID vaccine. Only around 20% are fully vaccinated. So we have a large population of kids who will be returning to school who are unvaccinated. Again, parents, please, if your child is between the ages of 12 and 17, I strongly encourage you to get your child vaccinated to keep them, reduce their risk of getting COVID-19. And the last thing about vaccine that I wanted to point out was I included the map from the CDC that shows vaccination rates by county. It's one thing to talk about where we're at in Oklahoma, but it's another thing to look at the county level data. There are counties that have very, very low vaccination rates in our state. So again, we're going to continue to see COVID-19 spread through our state as long as we have very low vaccination rates. So I want to get on my soapbox for just a moment. I've been very frustrated recently. I received many instant messages, text messages, emails, and others, particularly from patients around the state who tell me their doctor told them they should not get the COVID vaccine. And I want to make it clear that that's usually inappropriate. If you look at the CDC recommendations, they're very clear. There are only two absolute contraindications to getting a COVID vaccine. The first is if you had anaphylaxis to the first dose. So the only way you're going to know that is to get a first dose. And then second, if you have a known allergy to one of the components of the vaccine. Those are the only two medical reasons that people should not be vaccinated. And the components of the vaccines that we worry about for the RNA vaccine is something called polyethylene glycol. In my 40-year medical career, I've only seen one patient ever that had a documented polyethylene glycol allergy. And then for the Johnson & Johnson vaccine, it's something called polysorbate. Polysorbate is found in other vaccines, so if a person has had difficulty receiving other vaccines, we typically would recommend the RNA vaccines, which don't include polysorbate. But again, way too many people are being told that they can't take the vaccine, and that's simply not the case. I can't think, we've given well more than 50,000 doses through our OU health efforts, and it's rare for us to turn somebody away for the vaccine. Now, if you happen to have had COVID and got monoclonal antibodies, the IV infusion antibodies, you can't get the vaccine for 90 days. But there are very, very few medical contraindications to the COVID vaccine. So I strongly encourage you, if you haven't had the vaccine and you don't have a known anaphylactic reaction to the first dose of the vaccine, meaning you actually got a first dose, then you should consider getting the COVID vaccine. There is no cross-reactivity with any other medications, antibiotics. I've had people contact me and say, I'm allergic to an antibiotic, so my doctor told me I can't get the vaccine. That's not true. There are no antibiotic cross-reactivities with the current vaccine. So sorry to be on a soapbox about this, but I think it's an important message to make sure that people understand that the vast majority of Oklahomans are both eligible and can be vaccinated. There are almost no medical contraindications to getting the COVID vaccines. And in fact, I included a paper that was published within the last week that I found very interesting. It's just a small research letter, but it came from very credible organizations. Massachusetts General Hospital, Brigham and Women's Hospital, Vanderbilt University, Yale, and UT Southwestern. And they looked at 189 patients who had a true immediate allergic reaction to the RNA COVID vaccines. So these are people who, according to CDC, you would say they shouldn't get a second dose. But 159 of those patients said, I want my second dose, and got their second dose. And all 159 patients, including 19 of the patients who had anaphylaxis with the first dose, tolerated the second dose just fine. 32 did have some allergic symptoms that were treated with antihistamines, but they all tolerated it. Nobody died. Nobody went into the hospital. So it's not a definitive study, but what it does is raise questions about whether, even if you had some allergic reaction to the first dose, if it's okay or maybe safe to go ahead and get the second dose. I would strongly if you had a serious reaction to a first dose, to consult with an allergist, consult with your doctor, and be sure you get the vaccine in a place that has the capability to provide emergency care should you need it. But it did raise questions about whether you can go ahead and get the second dose. The next thing I wanted to touch on was breakthrough infections. I put the information in that's been widely publicized already of the outbreak that happened on Cape Cod in Barnstable County, Massachusetts, where they had 469 people come down with COVID-19 that attended events that were held in this town. 346, 74% of those people who came down with COVID-19 were fully vaccinated. So breakthrough infections definitely occur. 133 of those patients had genomic sequencing, and more than 90% were Delta variant, not surprisingly. So we know with Delta variant, breakthrough infections do occur, and they probably occur much more commonly than had been previously reported in the literature. The other thing that was interesting in that study is they measured the viral load. How much virus did these people have? And when they compared vaccinated to unvaccinated people, it was the same. In other words, vaccinated people who got COVID-19 could spread it to others. They had a lot of virus. That's why the CDC changed their recommendations that whether you're vaccinated or not, if you go to indoor events, indoor places, when you're around people that you don't know vaccination status, you should wear a mask. It's why we should be wearing a mask in schools, and it's very important that parents encourage their children to do that. The other point I'll make is being previously vaccinated gives you a ton of protection. 4 of the patients of those 346 actually did go into the hospital. Nobody died. So again, the vaccines are very effective at preventing severe disease and death from COVID-19. So after this all came out, the CDC had done an extensive investigation. The director of the CDC highlighted that COVID-19, the Delta variant, may be just as contagious as chickenpox. You would not send your kids to school if you knew there was an outbreak of chickenpox in the school, particularly if your kids had not been vaccinated. And you should not want your kids to be in school without a mask if you know that there's a virus transmitting in the community that is highly contagious, and that's what we have with COVID-19. So again, it's very, very important that we promote those public health practices that reduce the risk. So just some other things that I know there are some questions about. Will we need a booster dose? Perhaps the most common question I get now, will we need a booster dose? I can't give you a good solid answer yet. I think we will know. CDC is going to evaluate the data. You've probably seen that both Pfizer and Moderna state that they think you should get a third dose, but of course they both manufacture the vaccine and do have some bias in their recommendations. So CDC wants to carefully look at that data before they make a blanket recommendation about getting a booster dose. I think it's likely that CDC will recommend a booster dose for people who are immunocompromised, who have underlying medical conditions that put them at high risk of complications of COVID-19, or in patients who have had organ transplant or other things. I think that's going to be likely, and perhaps the elderly, they'll recommend a booster dose. Second question I get a lot of questions about is other variants. Lambda variant is the one that that a lot of questions. Remember, there was an outbreak in Illinois of Lambda variant, and we've seen a few cases of Lambda variant in Oklahoma. And the big question about Lambda variant is, will the vaccines, the antibodies that you generate when you get vaccinated, protect you against Lambda variant? We don't have a good answer yet. The good news is that right now we're not seeing a lot of Lambda variant in the United States. It's principally the Delta variant that's circulating. Perhaps a bit more good news, FDA announced that it's likely that they will give full approval to the Pfizer vaccine, and perhaps by September. So I think it's likely that you're going to see full FDA approval. I don't consider these vaccines experimental anymore. I just looked today, in the US alone, we've given 200 million doses of the Pfizer vaccine, 4 billion doses of COVID vaccine worldwide. I just don't consider that experimental anymore. They're safe, they're effective. And then finally, there have been a number of studies that have looked at the Delta variant. Does it make you sicker, quicker, particularly in younger people? So I know across the country, we're seeing more younger people. And when I say younger, I mean in that 20 to 55 age group, and others that are being hospitalized, some of them very, very ill. Again, mostly unvaccinated people get vaccinated to stay out of the hospital. My last graphic that we'll send out is about an interesting study from Sweden that showed that if you look at patients who have COVID-19, the risk of a heart attack or a stroke is dramatically increased. 8-fold increase in the risk of a heart attack or a stroke in the next week after you've had COVID. That actually did not surprise me. First, we know COVID often does cause blood clotting, and that's what causes strokes and heart attacks. But the other thing, we've known for years that if you get the flu, it dramatically increases your risk of a heart attack or stroke. So if you have known underlying heart disease or cerebrovascular disease, if somebody's told you have hardening of the arteries, you want the COVID vaccine, you want the influenza vaccine to protect you against heart attack and stroke. So I'll stop there and answer your questions.
When you were talking about the 40% in Oklahoma that have been fully vaccinated, is that adults or is that anybody who's eligible?
That's anybody eligible in the age group of 12 and older.
Okay. So since only 20% of kids are vaccinated, that brings the number down quite a bit.
It does. So even in the elderly, when you look at the data, again, 65 and older, only about 75% are fully vaccinated. Fully 25% are not fully vaccinated in the 65 and older age group. So again, there are a lot of people out there in Oklahoma who are still vulnerable to get this infection.
Okay. And also, just to reiterate, when you were talking about the anaphylaxis and the vaccine, that's why they have you sit there for 15 minutes. People get annoyed that they have to wait.
Yeah, so let's say, so one of the questions I received this past week, a person, a very intelligent individual, contacted me and said, I have anaphylaxis to an antibiotic, and my doctor told me not to get the vaccine. So I immediately said, yes, you may take the vaccine. There is no antibiotic or antibiotic cross-reactivity with the vaccine. However, when we give you a vaccine, we're going to make you wait for 30 minutes, and that's to watch for any serious allergic reaction that might happen. So when we screen patients to give the vaccine, everybody has to wait 15 minutes at least, just to make sure you're not going to have a reaction. Most people do not. But if somebody's had a serious allergic reaction in the past, then we will typically ask them to go ahead and stay for 30 minutes just so we can watch them a bit longer.
When you were saying like the Lambda variant, is that Gamma? Is that the same thing?
No.
Oh, okay. So what's going on with Gamma?
Gamma, I don't know a whole lot of information. I haven't seen a lot of cases about Gamma. Lambda variant came out of Peru. There have been outbreaks in Illinois and a few cases in Oklahoma. And again, with Lambda and with some of the newer strains, what we're concerned about is, will the antibodies from your vaccines still protect you?
And one reporter was asking about, so we want to encourage kids to get vaccinated, but how important is it also just to stress that their entire required vaccinations, how important all that is to protect them through the school year and
Yeah, so it's a great question. It's about, we're talking about getting kids vaccinated against COVID-19, but what about other childhood vaccines? Incredibly important that you make sure that your children are up to date on all of the vaccines that are required, both to go to school, but also to protect them. We don't want outbreaks of things like measles or mumps or other childhood illnesses. Chickenpox is a good example because your kids didn't get the vaccine. The other point I'll make is that the CDC has made it clear it's okay to take the COVID vaccine at the same time you take other vaccines. So we do routinely do that, give both COVID vaccine and other childhood and adult vaccines at the same time.
And have we seen any increases in Oklahoma on women who are pregnant in COVID?
I don't know if there's been a big increase. I know our obstetrics department has had a number of pregnant women who have had COVID. Remember that women who get COVID-19 during pregnancy don't do as well, and they're more likely to have children that are born with preterm issues and other things. So I tell all pregnant women, you don't want to get COVID, and the vaccine is very safe in pregnant women. And in fact, the antibodies that you develop probably give the baby some protection also, because the antibodies, not the vaccine, just the antibodies, do get into the baby and also into breast milk.
So we know that pediatric beds are full across the state in general. Are they still, majority of them still non-COVID patients, are we seeing?
Yeah, so I'm not a pediatrician, but in our children's hospital, most of the beds are filled with common childhood illnesses, trauma, and RSV. I think a lot of people know that RSV is another respiratory virus that spreads typically in the winter, but we didn't see it last year because everybody was wearing a mask. Took our mask off and, when the case counts got low, and we started seeing RSV spread amongst kids. RSV is around all the time. So the majority of the hospital beds that are full right now in Children's Hospital, many of them are RSV patients. They also do end up in the ICU periodically. They do require supplemental oxygen or treatments for their lungs, and rarely they do require ventilation. So yes, we've seen some COVID cases in kids, and the numbers seem to be going up a bit, but we also have a lot of RSV in the hospital.
How about beds in general, so adult needs across the state? Do you have any data on that, how dire that situation is?
Yeah, so I don't have a lot of data on that, but I've been on several conference calls with Patty Davis and Lawana Halstead with the Oklahoma Hospital Association. The biggest issue in Oklahoma right now is the shortage of staffing, nurses. Just because you have a bed available doesn't mean you can staff it and open the bed in a hospital. We lost a lot of nurses through the COVID pandemic. Some gave up, changed jobs, went working remotely, lots of reasons. So I think that's one of the big problems. Back in January, February, we handled the capacity with the big numbers of cases. We can't do it now because we don't have enough nurses and personnel to take care of all those patients.
Okay. Are we facing life in a world where COVID has become endemic?
Yeah, it's a great question. So the question is, are we facing life in the future where COVID-19 has now become endemic? So I'd say right now, so endemic is the concept that the disease exists in the background. There are always going to be some cases. Right now we're still in the pandemic, and we're seeing rapid rise in cases. But I think, as I tell all the medical students, going forward, COVID-19 will always be in your differential diagnosis of a person who comes in with fever, cough, particularly if they develop a viral pneumonia or other things. You'll have to always think about COVID-19. COVID-19, I think, is here for many years to come. We may see new variants in the future. I think even if we don't see new variants, if the vaccines work very well, if we have unvaccinated people, we will periodically see local outbreaks, particularly amongst unvaccinated people. So I do think COVID-19 will become endemic, but right now it's still pandemic.
And I don't remember when you were giving your data, if you talked about that, of the cases that we're seeing in Oklahoma. Did you have a percentage of how many of those were breakthrough cases? Or?
So the question is, do I know what percentage of cases in Oklahoma are breakthrough cases? And I don't have a number for Oklahoma. I know there are some numbers out there. If you look at the weekly epidemiologics report that the state health department puts out, they put that number in, but I think it's a gross underestimate because oftentimes when people get tested, that data hasn't been captured about whether they were vaccinated or not. Anecdotally, we're seeing a lot of people who've been fully vaccinated and are having breakthrough infection. Again, that's why I highlighted the study from Massachusetts, which showed that 74% of the cases that they had, and Massachusetts is a state that had relatively high vaccination rates, 74% of the cases were in patients who were fully vaccinated.
And have they looked at it as close as which vaccine they received?
They did in that study. The most common, I believe, don't quote me on this, was Moderna, followed by Pfizer, then Johnson & Johnson was third in terms of the number of people that received the vaccine. They didn't report breakthrough rates by vaccine.
So with the Delta variant being more transmissible, how important is masking and social distancing?
Yeah, so the question is about Delta variant since it's so contagious. It's so contagious because if you're infected with it, you have 1,000 to 1,200 times more virus in your upper respiratory tract, your nose, mouth, your lungs, than you did if you were infected with the alpha variant, the original variant. It spreads. I told people, think of a cloud that's around you when you're talking or doing anything, shouting, singing, anything, breathing. There's a cloud of virus around you, and a whole lot more of it with Delta variant. So wearing a mask is a very, very important mitigation strategy to prevent transmission. By myself wearing a mask, I reduce the amount of droplets that come out of my mouth and reduce to some extent aerosols. By you wearing a mask, you protect yourself from breathing in the droplets that might come out of my mouth. And then obviously physical distancing is important. The farther you are away, the less likely you are to get infected. Though I will highlight that if you're in a crowded indoor setting, we know the virus can travel far more than 6 feet. So if you're in an indoor setting with poor circulation, air circulation, the risk of infection is definitely there if you're not wearing a mask.
What is different this wave and increase in hospitalizations versus the last wave?
Well, so the question is, what's different now with the current wave of COVID-19 that we're seeing compared to the wave of COVID-19 that we saw in the fall and spring? And I would simply say, we're having technical issues here. I would simply say that two things are different. We're dealing with a different virus. The Delta variant, though it's a coronavirus, it behaves very differently than the Alpha variant that we were dealing with last year. Second, the number of cases is going up incredibly rapidly, much more so than we saw last summer. And we know that a certain percentage of people who get COVID-19 will end up in the hospital. And so now we're seeing a rapid rise in cases, and therefore we're seeing a rapid rise in hospitalizations also. The slope, the rate of growth of new cases is much steeper now than it was last year.
How many cases, when you said that we had the Lambda variant, do we know how many cases that we had?
I don't know. That the weekly epidemiological report does provide a breakdown of the number of variant that they've tested for. Of course, that's only those that they've tested. So I don't know that number.
So you don't know about the Lambda, is that what they heard me say?
Yeah, I don't know what the number of Lambda variant cases are that have been sequenced by the public health laboratory.
If someone suspects an unvaccinated person without a mask has been inside a building for hours and exposed to COVID-19, how soon should they get tested?
Yeah, so that's a great question. So if you're unmasked, you're in a building, you find out that somebody in the room, that space, has been infected, and you've been there particularly for a long period of time, then the recommendation would be that you get tested in 3 to 5 days. One of the things that we know about Delta variant is that the virus grows very rapidly, and so people become positive on testing earlier than they did with the alpha variant. So we'll test them as soon as 3 to 5 days after exposure, and certainly if anybody develops symptoms, then we would test them at that point.
And he's asking also if they test positive, who gets that information in Oklahoma? Does it get sent to local school districts where the person resides?
No, so if you test positive, the lab is required by law to send the data to the Oklahoma State Health Department. They will forward it to the county health department, who has responsibility if they're going to do any contact tracing, case investigation, and quarantine or isolation.
Okay, let's see, but estimate the percentage of people hospitalized who are unvaccinated.
Yeah, so the question is, what percentage of the people who are hospitalized with COVID-19 are unvaccinated? Multiple reports from across the country that it far exceeds 90% of the people who are sick enough to be in the hospital are unvaccinated. Again, from the Massachusetts study, they had 346 people who became infected that were fully vaccinated, and only 4 of those people ended up in the hospital. None of them died. So that's what we're seeing in Oklahoma too. The majority of people who are sick enough to end up in the hospital were unvaccinated.
Can you talk about the long haul syndrome? Many say that they don't need a vaccine for a disease with a 99% survival rate.
Yeah, so this comes up all the time. So right now in Oklahoma, if you have a positive test, if you get a positive test in Oklahoma, just under 2% of the people die. So the death rate is around the survival rate's around 98.2% based on known positive testing. There are some people that are in the community that never got a test done and they survive, obviously. But again, I want to go back and highlight, 8,500 Oklahomans have died of this disease. 613,000 Americans have died of COVID-19. It's unprecedented, the death rate that we've seen from COVID-19. So this past week, I posted on Facebook, I posted a headline that I saw in the medical news that morning that said, hospital morgues fill up again, and hospitals were renting refrigerated trucks to hold the bodies. I've been in practice for 40 years. I don't remember ever before any disease where hospitals had to rent refrigerated trucks to hold the bodies. This is unprecedented. So you can argue all day long that the mortality rate is relatively low, but as compared to most other diseases, it's much higher, much, much higher than the flu. And again, you're taking, to a certain extent, you're rolling the dice if you make the decision to stay unvaccinated, particularly at a time when we have a very virulent, very rapidly spreading, contagious variant of the COVID-19 virus circulating.
So would you say these unvaccinated people are gambling with their lives?
Well, I think, it's definitely a roll of the dice whether you get COVID-19 or not. And then again, if you have underlying medical conditions or others, your risk of being hospitalized goes up and complications go up. I think, I don't want to bring up something in particular, but we saw a preacher that came to Oklahoma who was actually relatively young. He was not that old, and he died of complications of COVID-19, developing blood clots. Nobody wants that to happen. But it's just a matter that, that if you get infected, you could have complications.
Are you encouraged at all with the uptick in statewide vaccinations?
Yeah, so the question is, what about uptick in vaccinations that have been occurring? I think Delta has made some people scared. Some of the people that were, as Dr. Wendelboe says, were vaccine hesitant or vaccine, how did he put it? They were just procrastinators. Kept saying, yeah, I'm going to do it, but now they've been motivated, and we are seeing more people getting vaccinated now.
Do you think that we're going to be opening up large-scale testing again? Or is there
Yeah, the question is, are we going to open up wide-scale testing again? That's being discussed. I know you can go to city, county health departments get testing done. Many hospitals, urgent care centers, others offer testing. But the question is, will we start doing more testing or even open up public pods that people can go to? I think it's going to depend on what happens with this current outbreak. If it keeps going up, we may have to.
And almost there. Do you have concern about hospitals being overwhelmed if the cases continue on this trajectory?
Absolutely. So we're just under 1,000 people with COVID-19 in the hospital as of today. So I am quite concerned about hospitals being overwhelmed, principally because we just don't have the staffing that we had when we dealt with the first round. We just simply do not have the staffing. There's a severe nursing shortage. We're doing everything we can to supplement that with other techs and staff, but there just aren't enough people to take care of if we were to fill up our hospitals again.
And do you think we are likely to see schools, colleges, and university outbreaks that cause school closures?
So the question is, do I think we will see school outbreaks, colleges that cause closures? I've been very upfront that I think it's going to be almost impossible to keep Delta variant out of classrooms, because we know that even if a kid is fully vaccinated, that they could get infected and they can spread the virus. So as I've told our staff, our teams here at the university, we have to be ready to pivot to online. Maybe not for the whole university, but maybe individual classes may have to pivot to online learning. I know the Oklahoma City school district, they've talked about going to alternate schedules or to going to remote learning for at least some period of time or periodically. I just think it's going to happen in Oklahoma just because of the rate of transmission. If you're in a school district where the community rate of vaccination is quite low, the risk of transmission of Delta variant is very high, and it's just likely that somebody, a kid, staff, somebody in the school will be infected and potentially could expose others.
Keep coming in. And just kind of as a follow-up to the hospitals, what is the tipping point for hospitals being overwhelmed? Are we close to that?
Yeah, so I don't know what the tipping point. I do know it's getting more and more difficult for hospitals, particularly in rural communities, to find a place to send a patient, not just COVID patients. So I was contacted about a patient yesterday that needed, special kidney treatment, and very, very difficult for them to find a place that could take the patient. I think we're going to see that much more commonly now. We've seen it in the news, people that have had to go long distances to find a hospital bed or had long delays in their rural community before they can be transferred. So I don't have a number for a tipping point, but we went up almost 100 more hospitalizations overnight. So I think we have to be quite concerned.
Okay, final question. What is your biggest concern right now?
Well, my biggest concern is we're seeing rapid rise in the number of cases. We're way ahead of where we were in terms of number of cases, and we haven't even opened schools yet. We saw cases go up last year when schools opened. And so I have big concern that when we bring all these people together in indoor settings with a contagious virus, that we're going to see more cases happen. I think one thing we didn't talk about, a lot of people in the medical literature are talking about whether we will see Delta burnout. In other words, it will infect so many people and in the process put a lot of people in the hospital and cause lots of complications, long haul symptoms, and even death. But then the cases will fall off rapidly. Can't predict that. We don't know at this time. That's what happened in India. It's what happened in the UK. But we're not there yet. We're still on that rapid rising number of cases per day, and I'm just so concerned that we're going to see a lot of people suffer with COVID-19 over the next month or two.